I'm Shannon Weber with HIVE, a hub of positive sexual and reproductive health. Do you want to introduce yourself?
So I'm Lynsay MacLaren. I'm a physician assistant at Whitman Walker Health in Washington, D.C.
Yeah, so we're here in Washington, D.C. It's May 2015, and I wanted to come and talk with you about the innovative PrEP work that's happened here at Whitman Walker Clinic. So first of all, paint the picture, what is Whitman Walker?
So Whitman Walker is a federally qualified health center in Washington, D.C. We serve a pretty broad population, half HIV positive, half HIV negative, so full primary care, little specialty in HIV care, especially GLBT care as well. We see a wide range of insurances here, a fair amount public like Medicaid, but we do accept private insurance as well. We expanded the Medicaid, it seems like years ago. I started in 2010, and I think it was already expanded even back then. So we don't have we do a sliding fee scale, but there's only a small population, honestly, and those are from the outlying states that usually don't have insurance. If you live in the district, you usually are able to.
Most people have some sort of coverage. And so when did you guys first start offering PrEP?
I think pretty much as soon as it was approved by the FDA. We definitely have been doing PEP for a while, and I think as soon as the FDA could, I think we started doing PrEP.
Awesome. And so when PrEP became a new opportunity for you, what did you find as a provider? Something that was challenging and then something that was exciting?
So the challenging part is to figure out how to get the HIV test done before seeing the patient. With our clinic, we have a testing and counseling part of the clinic that does HIV testing, and they have to ask certain questions, and it takes kind of a certain length of time to do that, and we can't do that on the medical side. So coordinating that to try to get them HIV negative first before seeing them, because we have had a couple where, I send them for the test and they come back positive already.
Right.
And so getting that loop down, and I think we're still kind of working on that, because you want to do
it's like a systems issue inside the clinic. And then what was exciting for you?
Exciting is trying to reach the populations at high risk before they get infected, to try to make an impact on that population. And that's still ongoing, and when you see the patient in front of you, you really do want to protect them as much as you can.
Help them, offer them some choices that they can make.
Exactly.
So you guys have probably been seeing PrEP longer than a lot of clinics, and so I'm wondering, because you mentioned this issue with getting the HIV test, and there are challenges when a clinic starts offering PrEP, and it can feel overwhelming. But I want to ask you, after doing it for several years, what is the follow-up? So once you've started PrEP in your clinic, or you started a person on PrEP, what's this ongoing monitoring like?
So I like to see them every 3 months still, basically to check in, kind of see if they're still at risk needing to be on PrEP, and checking in to see how their adherence is going, how the meds are going, and just kind of check in with them. If you can get them into healthcare by that and then address other health problems, it's a nice way to get them into care, because they might not normally be in care.
Yeah, we've seen that also, like a way for people to opt into wellness or to thinking about their overall health, which we didn't really have an end before.
Yeah.
So what do you think are next steps or new opportunities that are next, either for you or for the clinic or for Washington, D.C. around this PrEP?
I think D.C. in general, we need to figure out how to reach the most at-risk populations. So in the district, African American MSM, men who have sex with men, those are the highest risk. And then the next is African American women. And so if we can figure out how to get to that population, because they're definitely underrepresented in PEP and in PrEP. So to figure out how to get that population, as well as the trans females, which are at very high risk.
Correct. And then we had talked earlier briefly that you do have a woman in your practice who's on PrEP. Tell me about that.
So she came to me via her husband, who's a patient at the clinic, so he's positive, and she's wanting to get pregnant. And so she is very dedicated to not getting HIV. So her husband is undetectable, so he's already doing his part, and they always use condoms. And so we have her doing the PrEP every day, although some say that you can do it around ovulation, but she didn't want to take any chance, so she's just doing it the whole time. And if she thinks she's pregnant, then we'll stop at that time, but she's just really dedicated to
exciting.
Yeah, she's on top of her health for sure.
That's so good. Well, thank you so much for sharing your story.
Cool, thank you.